I'm Sheila. I'm the principal of the London College of Clinical Hypnosis. So this space is really created for you. Yeah. Because, I'm sure that some of you are curious. Does anyone have a question, or should I kind of just jump in there and ask you?
Hey, Sheila.
Hi, Thilika. How are you?
Hi, Anand. Thank you. I'm an anesthetic medical officer, and I'm interested to know about clinical hypnosis. And is it promising in future?
If you ask me, I think it's very promising, but I want to answer it specific to you. Tell me a little bit about your work. What do you do?
I'm an anesthetic medical officer.
Yeah, anesthetic. Yeah.
Yes, anesthetic. Yeah. So the main reason I'm here today is one, I would like to know more about clinical hypnotherapy, and I would like to help my patients managing pain, and I like to apply it on myself as well.
Okay, fantastic. All right. So first of all, the majority of research, evidence-based research on clinical hypnosis is to do with pain management. I think it's pretty much accepted that hypnosis has a role with both chronic pain and also with acute pain. Even the Ministry of Health here in Malaysia has reviewed the literature and has agreed that there is a role for clinical hypnosis in pain management. Okay, so is there acceptance? Yes. Is there research to support it? Yes. So how do we use it? So on a simplest level, you can teach your patients to self-manage. So if they have chronic pain and you teach patients to self-manage, it can mitigate their dependency on pain meds. So it can bring quality of life. So that's one of the things that you can do. We've used hypnosis with brachial plexus injury patients at University Malaya. We were working with a group where nothing else was working. They basically had intractable pain. And we taught them how to use the hypnosis in the first session, self-hypnosis. And all the cohort used it because they found it useful, helped them also with their sleep. And we spent 3 sessions teaching them on the hypnosis. And by 3 sessions, they were able to reduce their discomfort levels, their dependency on pain meds. And also they started to be able to address issues such as anxiety and depression. In the next 3 sessions, what we did was because we had felt we had done enough with the pain management, we moved on to things like, the embarrassment brachial plexus. So there's injuries that it caused the damage. So we helped them to build better confidence about themselves, to integrate more with their families. So it was an overall success. So that was brachial plexus. But a lot of anesthetists here in Malaysia also use it I'm saying a lot, several anesthetists here in Malaysia are using it in conjunction with the surgical process. So to prepare patients prior to surgery. So that's one way you can use it. And we know that 30 minutes of hypnosis will actually have benefits across the board. You can also, if you're doing simple procedures, branulars or what have you, you can use it in terms of distraction, to relax the patient, to reduce the anxiety. And we've also used it as a sole anesthetic here in Malaysia, where patients have an allergic reaction to anesthesia. It's just as important in government hospitals as it is in private hospitals. Patients come with anxiety. So you have to find a little bit of space to be able to do the hypnosis, because it takes a little bit of time. But what we found, and most of our anesthetists here have pioneered very fast techniques, so very quick techniques that take the patient into hypnosis, which is what you need in a surgical context. And the other thing it gives you is it gives you language, right? So the patient is already terrified generally when they're in front of you. They're scared,
Yes.
worried, whatever it is. So, and I remember Dr. Anand Chandrasekaran, who has been lobbying to have this into the Pain Society, with the at the Malaysian Anesthesiology Society. So he said, that when patients come in, he just got very saddened by the look of terror, and he wanted to do something. And, across the board, you actually build very nice, very positive relationships with your patients. Medical doctors will generally use hypnosis for symptom management of a specific cause. For those of us who are not medical doctors, right? When our patient comes in, we use it in a more psychotherapeutic way. So that we generally spend an hour with the patient. Patient will come in, we give the patient space to tell their story. So we validate their story, which is a really important part of it. We then, sometimes when you hear the story, but you have nothing to give, it can be very frustrating. So then what happens is, once you've heard the story, we take the patient or the client into a state of relaxation where the body starts to calm down, mind starts to calm down, and they start to feel more confident in themselves, more centered. And we talk to them then, say, you told me that it's so important to you to address this. And I'm going to tell you there's a very unique part of you, your unconscious mind, that I'm going to talk to help you to build up your confidence to be able. So you're talking to them in a particular way. So you learn to use voice in that way and language in that way. You address the problem, you build up that confidence to be able to cope. You then reorientate them, wake them up, and then you give them a little bit of homework. You do not need to be a medical doctor to do that. Yes, if you're going to go into a surgical theater, yes. Yes, if you're going to do specific procedures to do with pain management, yes. But most things, anxiety, low mood, mild to moderate depression, having a broken heart, grieving for a relative that maybe has just passed, dealing with relationship breakup, performance anxiety, eating too much, all of those things, you don't need to be a medical doctor. I think medical doctors will tell you, and certainly most experts will tell you, if we can mitigate and manage our stress, many of the complications that end up being lifestyle illnesses wouldn't happen. Right. So even just when you talk to someone, when you help them feel safe, when you help them to feel relaxed, when you help them to manage their stress, doing huge amount of good work. And I always tell people, the people who make the best hypnotherapists, yeah, aunties and uncles, mums and dads, older brothers and sisters, anyone who's told a story to a younger child, and that child is relaxed and got caught up in the story, you can use your voice, you can use your language. It doesn't have to be in English. You can learn the skills. When you go in and out of states of hypnosis, two things will happen. Your body starts to relax, your mind starts to relax, and you do it at the same time. And we start to relearn. When we were babies, we all knew how to relax. And then life came and we got stressed out and we forgot, right? So what you're doing is you're relearning the natural body response, which is to go into states of relaxation. That gives you a sense of confidence, it gives you a sense of calm. And one of the things specific to what you asked me is it gives you a sense of personal self-control. So I'm also quite hot-tempered, and I was more hot-tempered before I did the course. What would happen, right? Something would trigger me, and I could feel myself, my anger rising up and my hey is wanting to come out of my mouth. And of course, what generally words come out of your mouth, and then you go, I wish I hadn't said that. But with hypnosis, you get a sense, you get that personal control. So what happens is your temper might still rise up. You can feel the emotion rising up. Feel the words going to come into your mouth, but you have self-control. It's almost like you have a dissociative state going, if I say this, and this is going to happen, and then I'm going to feel bad, and then they're going to be angry. You get a sense of space between yourself and the reaction you're going to do. It gives you more self-control. Will it stop you if you want to get angry? No. But will it give you the space to make a choice as to how you behave? Yes. And it's one of the things that I loved about the course, because it gave me, instead of just knee jerking and reacting, it gave me that sense of control, right? And once you have that, lots of things happen. You become more centered, you become calmer, you tend to operate in a sense of knowing who you are rather than being a little bit out of control, and you relax. And the byproduct of hypnosis is we all get a good night's sleep, because body knows how to relax, and when you go to bed, you drift off. I mean, for me, if I'm awake after 15 seconds, that for me is stressful. I'm so used to going to bed almost immediately. And it's one of the nice things that happens. And if you want to get that control over your hot temper, it will happen. So first of all, is everyone capable of being hypnotized? Anyone who's capable of having a daydream, right, is capable of being hypnotized. So you know that feeling when you're driving along. Do you drive, Melissa?
Yeah, I drive. Yeah.
You're driving along and your mind kind of slips into autopilot. You turn left, you turn right, not really thinking about it. Get to a red. You kind of stop on autopilot, goes to green, and off you go. And you can arrive at a destination and go, don't know how I got here, but here I am. Yep. So that is a naturally occurring hypnotic state. It's called a hypnoidal state. And yet, if a child or a dog ran across the road in front of you, we go instantly to the brakes. So even though you're in your own thoughts, you're also paying attention. So that's very classic of hypnosis. So anyone who can enter that can enter the hypnotic state. And so what I'm basically saying, it's a naturally occurring state. Hypnosis is naturally occurring. What we do in the consulting room is use this naturally occurring state and do therapy inside of it. Why do we do it? Well, lots of different things happen. The anterior cingulate cortex, which is the part of our brain that measures our sense of suffering, we can switch off the firing there, right? So other parts of the brain do physically respond, and you can actually see them in fMRI, how the brain responds. So yes, you can see those reactions. But the other thing that happens is the sensation that we experience. So the pain sensation also gets dampened down in hypnosis. So there are physiological changes that happen. So we use it if we're doing for pain management, we use it for those reasons. The smooth muscle in our stomach, right? For people with IBS, that is very suggestible. So when we give gut-related imagery, that part of it also slows down. So we know that the body responds to hypnosis. So that's one part. But to answer your question specifically, the research shows that 90% of people can enter a light hypnotic state that's induced in the consulting room. And of that 90%, 70 to 90% can go into a medium state. All right. So if you ask me, will you be able to hypnotize everybody you meet? Answer is no. We can't hypnotize everybody. There's always someone we don't get rapport with. But is everyone hypnotizable? Probably. Does that kind of answer it?
Okay.
Okay.
Yeah.
That's step number one. And you know that state when you're going to sleep and your body gets heavy and tired. You know, sometimes we sit in front of Netflix and we watch it and then we kind of drift off. That state just before we drift off, it's also a naturally occurring hypnotic state. So that's why I say pretty much everyone can go into hypnosis. Okay. So that's your first question. The scientific evidence. So there are more and more research studies that are showing the efficacy of hypnosis. So we know that hypnosis and pain management is pretty much established with thousands. I think there's about 7,000 to 9,000 research papers on the efficacy of hypnosis. Hypnosis and IBS in the UK, hypnosis is the number one treatment for irritable bowel syndrome because it's most efficacious. And we see patients 15 years now, 25 years after treatment, still remaining symptom-free. So it's quite commonly used in those. Yeah. Are we measuring the brain states? Yes. Have we found the definitive state for hypnosis? The researchers say that they are basically on the brink. But because hypnosis touches many different states in the brain, many different places in the brain, it's possible that there won't be one specific state, but there'll be certain specific actions, like the anterior cingulate switches off or the insula is activated through hypnosis. So we can see those things, right? So that's what I'll say on the scientifically proven stuff. Pretty much there, and the research coming from neuroplasticity is beginning to show specific evidence. Yeah. As much evidence as you see for mindfulness. Okay. So how many sessions typically are needed? All right. So if you ask most practitioners, we will tell you hypnosis is 85% effective, one session for smoking cessation. The research is 65% for one session. But most of us will use a number of different specific techniques. And I don't just mean from LCCH, I mean globally, we're seeing about 85% effectiveness for smoking cessation. For weight management can be one session, but that depends on how motivated your client is. If your client is not so motivated or they're bombarded with all the lovely food we have in Malaysia, I would tell you it's probably 5 sessions, right? And they might need a top up. Weight management is more a lifestyle change, right? And because we live with so much accessible and probably wrong food, that needs a little bit more management. But generally, when I'm working, it's 5-session protocol. Yeah, over maybe a 3-month period. Generally, today I will suggest maybe having 2 top-ups in a year, just to make sure we all backslide. Yep. So to make sure that that's smoking cessation. Hypnosis is known as the oldest Western psychotherapy. It even predates psychoanalysis. And it's also known as a brief strategic therapy. In other words, when we add it to CBT or counseling or EMDR techniques or any of those other techniques, what we see is the research shows us that the number of sessions you need is less and the effectiveness of the therapy is more. Right. And that's because hypnosis works both on the emotion and the unconscious level, as well as the thinking mind. And so that's one of the reasons. We teach people to formally do it online. And I'll tell you why. It's just as effective. But there are a few things you want to do. So when you welcome someone into a physical space, you open the door, you smile at them, you bring them in, you make them comfortable, you might give them a glass of water. So when you're doing that in a virtual space, there are slightly different protocols. So we formally teach that to you. We teach you what to do if the internet is choppy or if it drops. We do have safety protocols in there. We've been doing online therapy, what's called teletherapy, for 30 years. So the research is there for 30 years, but it particularly came into its own during COVID when everybody asked the same question. Yep. So, and we ran a conference actually in the first year of COVID just to see globally how people were managing it. And everybody managed it much, much better than they were ever expecting. So what I can tell you is yes, most of my graduates will be working. So some will be working with patients 5 minutes away from them. Some will be working with patients who sometimes travel. So sometimes they're home, sometimes they're traveling. But many, many more therapists are working on an international and global field. Yep. And it's a nice way of working because it opens up your practice. Yep. It means you're available to your patient when they most need it, which is generally in the evening. It means that your patient doesn't have to drive through congested traffic to get to you. It means that if they're in Malaysia but they travel to Japan, the therapy can continue. But we also found this really interesting thing. We started to get patients coming to us who typically didn't come for therapy. And it's because they felt safe to reach out to therapists from the safety of their own home. And we were not expecting that. Many more of these patients reached out because they felt safe in their own home to reach out to therapists, and more therapists were offering it. Yeah. So by all means, do that. And, your overheads are lower because it's a Zoom account. So, if you're starting, your overheads are lower. It means that you can manage your practice much more easily. And most of my colleagues in the UK, virtual practitioners now, very few of the people that I know see patients or clients face in a physical space. In Malaysia, we tend to be a bit more 50-50, but Malaysian patients, just like all international patients, are very comfortable with the virtual platform. How many sessions are recommended for someone suffering from nerve pain and medicine doesn't work effectively? What's the recommended number of sessions? Okay, so everyone is unique. So with clinical hypnosis and most psychotherapies, we treat each individual as unique, and we treat each individual circumstance as being unique. All right. So I have got a gold standard from you. What I can tell you is if the person is experiencing nerve pain, discomfort, right? The first thing you would do is you welcome them into the space, you take a case history, and you probably teach them self-hypnosis. Why? Because it can self-manage. All right. Then we have a number of techniques. So pain is functional, right? We have pain to let us know that, there's either some damage or we need to take some care or we have to be more careful of a particular space. So it's functional. And we don't have to have a pain signal to make us aware. So we can reframe sometimes the pain sensation so we can make it into a warm sensation, cold sensation. We can give it a sound. We can actually create a space where we're not feeling the sensation, but we give the unconscious mind a signal that if any change happens, it alerts us. All right. So there's many, many different ways of reframing how we experience the sense of discomfort. And probably the first thing we do is we stop using the word pain and we start using the word discomfort. And so that's one way of doing it. The other way is sometimes because of nerve damage, because of the injury the patient has sustained, they are going to be in chronic physical discomfort, right? So what we want to do is we want to help them to manage that so that they can have a sense of quality over their experience, right? And so, you can negotiate, if you like, with the mind to what the mind is prepared to accept. You can turn down the threshold. You can turn down the sense so that instead of experiencing it at 9, you're experiencing it at 1 or 2. So you have a lot of management that you can do around a level of discomfort. Now, okay, people are different. So I have sometimes patients that come to me who have cancer and have pain associated with the diagnosis or with the treatment they're going through or with just the condition. Sometimes you can't remove it, right? Sometimes it's just the situation they're going to go through. So they come up for top-ups. You teach them how to self-manage. You give them an audio tape that they can play to themselves. So, but what you're doing is you're looking to create quality of life. There is some research to show that when we experience childhood trauma, it has an impact in our brain architecture that makes us more easily triggered by anxieties in adult life. We know that hypnosis helps us to deal with the triggers today, right? We also know that hypnosis can help us to go back into our memories and to change how we remember them and change how we respond to those memories in our mind. Yep. So yes, a lot of work you can do with it. And it's nice. We don't teach so much of trauma work on this particular course. This course is about laying your foundation so you have the confidence to work. But once you've got that, you can go and specialize in victims of childhood trauma, in healing trauma that's manifesting in addiction or eating disorders, or even dealing with entrenched anxiety or depression responses.
I have a question. Can a person going through mental health issue or trauma, take up the clinical hypnosis, and can it help them?
Okay. So I'll share a story of the first course I ever ran in Malaysia. There was a brother and sister who came. The brother really wanted to do the course, and the mum said, only if your sister can do it as well. Sister was diagnosed with bipolar, right? And I was a little bit nervous. I was concerned. So I said, and she was under psychiatrist. So I said, you can, if your psychiatrist agrees. All right. So we worked together. Psychiatrist agreed. He said there was no harm that would befall this girl. So she came on. She did the part 1, and then brother wanted to do part 2 and part 3. So we asked again, and again she did the part 2 and part 3. Halfway through the course, she said I was looking in the mirror. I always remember her saying this. I was looking in the mirror, and she said, I just figured I'm this beautiful, wonderful human being. And I don't think I have a mental disorder, right? So it gave her the confidence to ask this question. She went for second opinion. She went for third opinion, all right? And actually, she had been wrongly diagnosed. I won't bore you with the stories of that. She was wrongly diagnosed. She found there was a psychiatrist who worked with her. Today, she's actually a famous clinical psychologist in Malaysia, all right? So can good things happen? Yes. It can give people the confidence to relook at themselves, to recalibrate themselves. Not everyone is wrongly diagnosed. Sometimes if we come on the course, we have low mood, right? Or what do they call it? High functioning depression. It can give us skills and tools to manage. If we have an anxiety disorder, it can give us skills and tools to manage. If we have panic attack, now panic attacks, people who have panic attacks, they need to tell us that they have them, because when you go into hypnosis, if you are someone who's prone to panic attacks, you feel like when your body feels like it's relaxing, feels a little bit like loss of control, right? If you are a panic attack person, that can feel like they're about to go into a panic attack. So we have ways of managing it as well. So there's a lot of different ways of working with people who have mental health care diagnosis. Basically, the rule is if someone is not stable, they shouldn't come on the course. Will something happen to them that's bad? No, not really. But what will happen is the course will they will go into a state of relaxation. They might feel better connected to themselves, and they might get very excited and talk a lot about it. And so the course will become about them rather than about hypnosis. That's generally what tends to happen. So we always make sure that our students are stable and able to engage with each other. I had one young lady who she's also now a practicing therapist. She came on our course, and she came on our course because she did have bipolar, but it was very well managed bipolar. But what happened was she was on the back of a motorbike, and and it was hit by a lorry. When she woke up, her husband was killed in that accident. So she was left as a young mum to bring up these two kids. And she wanted to do the course because she wanted a skill that would help her to self-manage and to self-care. And it took her a while because she wasn't very stable. So we insisted that she did therapy before she came on the course. So then she came on the course, she worked with that tutor. Then she came back and she finished the course, and she's now doing really, really well. So sometimes it's a journey as well. Yeah. And I've learned from that, that actually people grow and people deserve the right to grow. Hypnosis was traditionally, I think when I trained, which is 30 plus years ago, hypnosis was traditionally known as the most effective treatment for smokers. We got a lot of business from people who wanted to break the smoking habit. Even today, right? They're a smoker. They are really, really great clients for this reason. They are so happy when they have broken the smoking habit, right? They will have tried a bunch of stuff before they've come to you. And you feel a bit disempowered if you smoke and you can't say no to a cigarette. You kind of feel like, "Ah, God, I can't even say no," right? But when a smoker actually breaks that smoking habit, they feel amazing. They feel so proud of themselves. And the script is like that. It kind of says, and you feel 10 feet tall. You feel so proud of yourself that you said, no, thank you. I'm a non.
Sure. Yeah.
Put all of that in there, right? They are the best referrers of clients. They'll tell everyone, I went to see this hypnotherapist and I stopped smoking. So they're great for your practice building. Weight management is the other one. And my business is not really built on smokers. My business was built on actually one girl who came to see me in London. I'll never forget her. So she did her 5 sessions. She goes, I think I'm in control of my weight now. But I'm calm and I want to work on other stuff. So it was great. She worked with other stuff, but she sent everyone that she could think of to me. And it was lovely. I've built quite a nice practice from just that one client. Right. So, when someone comes for smoking cessation, you take good case history, you find out what triggers them. For some people, it can be workload. For some people, it can be work environment. I remember having a film director, and it was really difficult to work with him because everybody in his environment smoked, right? So environment. Sometimes it's, people smoke a lot when they go out and have a drink or they socialize with a particular group of friends. So you might negotiate behaviors, right? So you might say, so as a non-smoker, you don't smoke, and there's certain things that you need to do to look after yourself. So maybe for 3 weeks or for 6 weeks, don't go hang out with your friends in the pub where you're all smoking and drinking, because you may be tempted to pick up, especially if you've been drinking, because your impulse control is lowered. Yeah. So you will negotiate certain behaviors, but those are not lifetime behaviors. You don't give up your friends for a lifetime just because you stop smoking, or you don't give up a social drinking or whatever it is because you stop smoking. But sometimes you need to let the habit atrophy a little bit before they go back into those spaces. And then you give them cues. So other people smoke. That's a fact. And you let them get on with it. And then you have certain suggestions that you can use there as well. And it can be very, very effective. Now, one of your lecturers, Peter, so Peter and I trained around about the same time. So Peter, we're both ex-smokers. Peter would never pick up a cigarette and put it in his mouth again. He's too scared. All right. But because he's our director of studies, our guru, but he's too scared to do that. I would tell you I can pick up a cigarette anytime. I just hate the taste. All right. People have different responses as well. Substance abuse can be different. Yep. Substance. So, I mean, you don't go and sit around and, I don't know, take cocaine with your friends if you've broken the cocaine habit. It's that would not be a never do, right? So addiction's a little bit different.
Right.
Yeah.
Thank you, Sheila. Thank you.
Jasmine, good question. Are you working in this field?
Oh, no, I'm not.
So any particular reason for asking the addiction questions?
This has been like going on for quite a while. I've been trying to kick the habit, right? But I'm in the sales industry. So the thing is, my kind of work does not allow me not to kick off certain bad habits that I have. So I was like thinking, if this can help, it will be very, very good for me to have a good start.
I can tell you, if you want to break the habit, it's actually easy. If you don't, so you need to build up that motivation to break it with sales and with workplace drinking. So I have a lot of clients who I've had one where, they want to be in control of their weight, but they have to take people out for dinners. I've had smokers. I've had also, I need to take my customers out. And so I have to have a drink. I can't have water. I can't possibly have water. I need to have, a hard drink while I'm going through the pitch or whatever it is. All of those I've been really successful with. If you want to stop smoking, Tasman, don't yourself, you can. All right, guys, you have asked me such fantastic questions. I hope some of you come on board because I'm sure you'll ask me more. If you have any more questions, anything specific that you want to know that have to do with your work or any journey, just reach out. Happy to answer.